By improving her circulation, we're also addressing another one of the components in cellulite.
Sunscreens generally will have more of those ingredients that are creating controversy.
Today we're going to tighten up his buttock, which has come loose because of weight loss.
So you're putting that toxic oil onto your skin.
Okay, so her hair has a lot of movement, and one color blends into another.
You've got to discipline your mind to have positive, productive thoughts.
It's really almost like turning back the clock to make your skin.
Wrinkles and aging is not just about individual line and wrinkles, but rather about volume loss.
Coming up next, we visit the International Anti-Aging Show. We're at the International Anti-Aging Show looking at a really interesting technology. Imagine liposuction without the surgery. This is Judy. Judy, you're going to talk to us about this. What is going on here? Look at this.
What you're seeing right now is UltraShape, a body contouring system.
Okay.
It actually dissolves fat using focused ultrasound energy.
Dissolves fat.
That's
I
correct.
like those two words together, dissolves and fat.
What happens is the sound waves convert into energy and actually disrupt the fat cells.
And that's what she's doing right here?
That's correct. And our lovely model, Antoinette, has generously donated her thigh.
Now, is this going to hurt her? Is this painful?
It's absolutely not painful at all.
No?
But best of all, she can resume normal activity immediately afterward.
Okay, how many procedures do you need to get done?
And it is a 3-treatment protocol.
Okay.
Each of these treatments scheduled 21 days apart.
21 days apart, and
That's
how
correct.
long is the treatment?
Treatment takes about an hour.
Okay, wait a second. Let me see if I got this straight, Judy. 1 hour treatment,
That's
3
correct.
treatments, 3
That's
weeks
correct.
apart,
That's
and your fat's going to dissolve.
That's correct.
That's what you're telling me, right?
That's correct.
Okay, and what percentage of the population does it actually work on?
So far, it has been Health Canada approved in May 2007.
Right.
And all of our patients, as of today, have all achieved a minimum of 2 centimeter fat thickness reduction.
Okay, good, very good. Now, what about safety?
It's completely safe. Primarily because it's non-invasive.
Okay.
It was developed in Israel in 2004 and has been done all over Europe since then.
Well, if it works the way you say it works, you guys are going to be having a very good business here. I can tell you that, because it's a non-surgical alternative to liposuction.
That's correct, for the right candidate.
Now, when you say for the right candidate, what do you mean by that?
It needs, they need to be a healthy individual.
Healthy,
Their BMI has to be less than 30.
Okay.
And
so you can't be very overweight. You have to be in fairly good shape with little pocket areas that you want to dissolve.
That's correct.
Okay.
Stubborn pockets of fat that dieting and exercise are just not
going to do it.
Yeah,
It's
that's
like
correct.
it's hereditary. Like my mother gave me these little side saddlebags.
My mom gave me a little more than
Yeah.
that.
Okay, well that's great. This is really exciting. Congratulations on bringing this technology here. And
You're more than welcome to come by and have the treatment done, and we can take before and after pictures.
photos,
Yes.
you're willing to do that?
Yes.
That's brave. That shows they're serious about it. I just may
right.
take you up on that.
Please do. Please
Okay.
do.
By improving her circulation, we're also addressing another one of the components in cellulite.
Sunscreens generally will have more of those ingredients that are creating controversy.
Today we're going to tighten up his buttock, which has come loose because of weight loss.
So you're putting that toxic oil onto your skin.
Okay, so her hair has a lot of movement, and one color blends into another.
You've got to discipline your mind to have positive, productive thoughts.
It's really almost like turning back the clock to make your skin.
Wrinkles and aging is not just about individual line and wrinkles, but rather about volume loss.
In the world of medically supervised diets and laparoscopic procedures, people are losing a lot of weight, and they're going to Dr. Adifar here. We're at the International Anti-Aging Show in Toronto. Do people know that when they're losing all this weight that they may have to actually tighten up their skin?
Most of them know that. However, there may be some that may not have been prepared properly for that. But in general, patients that have gone massive weight loss should expect quite a few stretch marks and quite a bit of laxity
What's
of the
massive?
skin.
50 pounds?
Well, it depends on your body mass index, but in general, massive is anything more than 50 pounds. Now, it can go from 50 to 200 or 300 pounds.
And it's just a lot of sagging skin.
Therefore, as a consequence, you're going to get a lot of saggy skin. Now, this saggy skin could be in your face and your neck.
Yeah.
It can be in your arms. It can affect your breast. It can affect your whole torso, your tummy, your buttock, and your thighs. So depending on the areas where you have saggy skin that does not have any potential for it to shrink back, then you may opt to get some surgical procedure for a body lift or a face lift or a breast lift.
Now you're saying a body lift is pretty much like tucking in your shirt and pulling up your pants. Just
That's
making
exactly
sure
what it's, except that it's a surgery and there is some potential complications and a little bit of downtime with it.
What about for mothers that just had a baby? Maybe they gained an excess of weight, they have that saggy skin in the stomach, or after they finish breastfeeding, their breasts start to droop. This is for that as well.
Yes, it's for that as well. Now, those are not massive weight loss patients, but those are patients that have had muscle laxity and some stretched skin. Therefore, they'd be a good tummy tuck candidate. And because they have breastfed, they lost some of the volume in their breast, and the skin of the breast is stretched. So therefore, they may opt to either get a breast lift or a combination of a breast implant and a lift to give them that rejuvenated look to their breast.
Now, is age an issue? Like, when you're younger, you have obviously more elasticity in your skin. So could you bounce back from that weight loss better when you, let's say, you're in your 20s rather than when you're in your 50s?
Well, age is definitely an issue, but there's more to it than age. Race is an issue. That's important.
Really?
And also, what kind of a body you started with is an issue. Obviously, if you had a massive weight gain during your pregnancy, you should expect to have more excess fat or stretching of the skin and laxity of the skin afterwards.
So what are some common areas that people get done?
As far as, common areas are obviously in postpartum patients, tummy tuck and breast lift and implants are common. As far as massive weight loss patients, as you know, morbid obesity is quite common in North America. In the United States, 30% of the population is morbidly obese.
30%?
Yes.
30%.
Now it's better in Canada. It's not that bad. It's only 15% in Canada. But you can just imagine what percentage of patients are going to go either massive weight loss through diet or gastric bypass, and all of these patients may need surgical lifting of the body.
So if you think you may be one of them, Dr. Adifar Elements, it's gonna tighten you up and make you that perfect you. Thanks very much,
Thank
Doctor.
you.
Thanks very much.
By improving her circulation, we're also addressing another one of the components in cellulite.
Sunscreens generally will have more of those ingredients that are creating controversy.
Today we're going to tighten up his buttock, which become loose because of weight loss.
So you're putting that toxic oil onto your skin.
Okay, so her hair has a lot of movement, and one color blends into another.
You've got to discipline your mind to have positive, productive thoughts.
It's really almost like turning back the clock to make your skin.
Wrinkles and aging is not just about individual line and wrinkles, but rather about volume loss.
Every year we visit the International Anti-Aging Show. It's so much fun to see all the new technologies and procedures. We're at the International Anti-Aging Show today, and we're talking about body contouring and cellulite and weight loss, all those good things that we love to talk about. This is Linda and Lisa, our patient, and Dr. Krisafi. You're going to help us out with this area, right? All right, so first of all, let's talk about what you're doing. What is this contraption here you have?
This is an endermology treatment. We work on cellulite and body contouring.
Okay, endermology, right? I've heard of that before, yeah.
It's the most recognized technology across the world for the past 21 years for the treatment of cellulite.
Okay.
Now, the way we work, we activate the lymphatic system up to 400% with this technique, with specific maneuvers. We also increase the blood circulation, which nourishes the cell, which helps burn the fat, actually.
And that's important, right?
It is very important.
Okay, now how does it affect cellulite specifically?
Because we increase the lymphatic, we flush the toxins and we mobilize the fat cells in the hypodermis to make them shrink. And that is where cellulite is. And it's all mechanical and non-invasive.
Okay,
There
non-invasive.
is no pain
Okay.
related to this whatsoever.
So how many treatments would you need and how often?
We need about 2 treatments a week in the beginning to kick off the treatment.
Okay.
After that, after 15 to 20 sessions, you should be expecting the final results. After 3 sessions, you're going to be seeing a huge change on your body.
Okay, and every month then I guess you have to do maintenance?
To maintain the result.
Now for the beginning 2 times a week for how long? Like 4, 5, 6 weeks?
Absolutely.
Okay, all right.
The first 3 sessions, you should be seeing a change on your skin, on your cellulite.
On your cellulite?
On your cellulite, and especially on the contouring.
Contouring as well.
You would lose a lot of inches.
Okay, all right. And Dr. Krisafi, what do you recommend? You're a naturopathic doctor?
That's correct.
And in terms of food and our diet, and what else can we do in
Drinking
this area?
sufficient water, getting a lot of antioxidants in our diets, fruits,
Right.
vegetables, etc. Detoxifying on a regular basis helps a lot, helps to clear the lymph. Exercising, as I mentioned, plays a major role. And then the other thing is to find out if there are foods that you are intolerant to.
Oh, well, what does that mean, foods that you're
A
intolerant
food
to?
intolerance is not an allergy per se. You can react anywhere between 3 hours and 72 hours after eating the food, which makes it difficult to detect.
Okay.
Food intolerances can cause water retention. They can reduce metabolic rate, the speed at which the body burns calories, so
Ooh.
you start gaining weight.
Okay.
They can have a role to play in increasing inflammation globally,
Right.
which has a role to play in disorders like migraines or arthritis, fibromyalgia, irritable bowel. And we have to find out what they are. There are blood tests available
Okay.
that permit us to detect the presence of
So
food
you can ask your
intolerances.
doctor for a specific, what type of blood test is it?
The
Something
test
specific?
is called ImmuPro 300. It's the only test in Canada done on food intolerances.
Okay.
We test for 267 different foods or substances or food substances.
Now,
and it's a
it-
blood test.
Now, does the food intolerance affect our aging? Or
Yes,
how
it
we
does.
age?
We know that increased inflammation and global inflammation, even if it's minor, increases the speed at which cells break down
Okay.
and slows down the capacity of the body has of repairing itself. So it actually works on both variables of the aging process.
Okay. Well, that's really great information. Thank you both so much for the demonstration and for letting us know about these food intolerances. I like it. I'm going to look that up.
Thanks for having us.